Afternoon. I am Nelvis J, and I choose the research track for my presentation. And the topic of my project is literature review and survey on the usability of clinical decision support systems, aka knowledge based systems in healthcare. So, knowledge based systems, or KBS, provide intelligent decisions with justification by utilizing artificial intelligence tools. KBS has been KBS has the potential of being used in healthcare to perform diagnosis and to make intelligent decisions in disease management. The ultimate goal of using knowledge based systems will be to produce a response and reasoning that is the same or even better to that of a human being at any given time or scenario. This field poses a great challenge as our current technology is unable to design a system that completely understands human cognition and behavioral responses. Knowledge based systems in healthcare are typically called clinical decision support systems. Clinical decision support systems are computer systems designed to impact clinician decision making about individual patients at the point in time and this that these decisions are made. So this is a graphical representation of a clinical decision support system where data is input from different sources. It could be a database, a website, or some other kind of reference. And then that goes through an inference engine and a knowledge based algorithm that interprets the data and then gives results that can be helpful to a clinician. So this is another representation of a clinical decision support system, and it says that you can describe it in five right things. So that's the right information, the right person, the right format, the right channel, and the right point. So any um, system that is built with the correct algorithms to help clinicians provide the right information to the right person at the with the right format through the right channel. That's a clinical decision support system. So it's a really broad topic. So this is also a representation showing that an instance of data can come from a database or it can come from a domain knowledge such as a website, a clinical reference database, and that goes through a decision support algorithm. And the output of that is information, actions, and alerts. So this is actually a graphical representation of what of a clinical decision support system, and in this case, is a system that tracks blood glucose and insulin for clinicians in the hospital. So you can see that there is a graph trending different blood glucose levels for a patient, and then this system keep tracks of those levels and can alert the clinician if the values are out of range, unusual, or if it's or if the values or based on the values, if maybe any therapeutic adjustment needs to be made on the patient's insulin. So the objective of this paper is to review and synthesize published literature to identify issues facing the clinical decision support system. So for the methods, um, so I searched on using Google's Scholar, PubMed, Embase, and my searches included articles published all the way through April of 2017 with key terms: usability, clinical decision support systems, CDS, CDSS, knowledge-based systems, KBS, clinical systems, electronic health systems, EHR, EMR, and the goal was to assess the usability issues of clinical decision support systems. So studies that did not address issues related to the usability were excluded from my review. So, part of my project was to propose a survey to better identify usability issues in healthcare. So, as part of my review, I reviewed a lot of different articles, out of which I would just mention a few here in this presentation. One of them talked about clinical reminders. Another one talked about electronic health record documentation. And the third, the computerized provider order entry systems, which is CPOE. And another one talked about involving patients in clinical decision support systems. So, because of the sake of time, I cannot go through, all the details of what those studies talked about. But apparently, what was interesting is that um, all the studies um, indicated that there were significant usability issues of the current clinical decision systems that we have in healthcare. So, the impact of clinical decision support system can easily be described in terms of various technologies and different case studies in which it has been incorporated. All of the studies that I reviewed confirmed a positive view of the usability of clinical decision support system. Some of the identified positives that I noticed in the different articles that were reviewed is that uh, clinical decision systems help to increase learnability, increases efficiency, usability, and it helps to build in integrated workflow reminders. It also increases the ability to receive prompt and feedback. It decreases workload, and it improves safety and documentation quality. However, some of the flaws of the issues that were noticed with this clinical decision support systems were lack of coordination between clinicians, increased workload, lack of flexibility, increased time to document or consult, especially that's a big issue with physicians, limited training because you have all these vendors that produce the clinical decision support systems. However, enough training and support is not provided to the clinicians, and also a lot of clinicians have a very steep learning curve to actually know how to use the systems effectively. So another issue had to deal with high cost, increased complexity, inadequate data exchange, data privacy concerns, and lack of workflow consideration. So pretty much a lot of the systems are built without really taking into account, the workflow of different clinicians, and so a lot of clinicians are not really involved in the decision making of building the systems itself. So, as part of my project, I proposed a survey that had 33 questions. Unfortunately, I cannot show all of them in this presentation. That's just a display of a few of the questions that I included in my survey. So, initially, the goal was for me to obtain IRB approval and have a good number of hospitals in Maryland participate in this survey, but unfortunately, I was unable to get most of the hospitals give me an approval, especially because of time constraints. But the goal would be that after the end of this class, I would still continue with my struggle to see if the survey is going to be accepted by the different hospitals. So This is just a few questions in the survey and a total of 33 questions. So the conclusion is that based on this review, it's evident that many healthcare technology issues still remain unaddressed, and barriers to the use of clinical decision support systems limit the adoption of clinical decision support systems in some healthcare settings, especially in ambulatory and outpatient care settings. So, larger healthcare institutions that have mostly adopted the use of EHR, which is a clinical decision support system in itself, especially due to the need of patient safety, efficiency, and interoperability. So, the future advances of clinical decision support systems may involve medication reconciliation, screen monitoring among multiple EHRs, biosurveillance of public health issues, quality and risk management functions may become more extensive, and the increased use of artificial intelligence in healthcare. So, a major limitation to my review is the inability for me to find a lot of articles that specifically cover the usability of a wider spectrum of clinical decision support system applications, such as smart pumps, automated dispensing cabinets, neural networks in medicine, and generic algorithms. So I would like to thank the course instructor David Joyner and my mentor Chris Kreider for their ongoing support throughout this project. I would like to thank all the TAs and to you all for listening and for your support in this class. And please, when you get the chance, you can review my project on peer feedback. And also, if you have any questions, let me know. And thanks a lot and have a good summer.